Chapter 33 deals with group therapy, and I do not want it to fool you. It's a pretty in-depth chapter, even though it's just a few pages long. I have included under your content page a sheet for you to work through to do some observation of a couple group therapy sessions through YouTube. And I highly encourage you to go through that and spend about the 45 minutes that it's going to take to understand the chapter. And I think if you do it in that way, it'll benefit you greatly. But just a quick overview of the group therapy chapter. Talks about, the benefits of group therapy, cost effectiveness, the ability to have other input and work with other people so that patients can benefit through those group interactions. Money, finances, you can see more people in a group than you can without a group. There are 11 therapeutic factors in groups on box 33-2, things that a group can do for a patient where individual therapy is not beneficial or is not as effective. Then it goes into some of the disadvantages, and it talks about disruptive group member behavior and privacy, not wanting to share everything in front of other people. So that's just basically the jumping off point of our study of group therapy. Talks about terms of group work, also the kind of group membership, phases of the group, the difference between an outpatient group, so say you were in a community in which you wanted to attend, perhaps a AAA meeting, or in the videos you will see that outpatient group dealing with stress. I thought it was very appropriate for students at this point of your scholastic career, so I thought that would be beneficial. And how does that differ with the inpatient group setting? Somebody that you would find in an acute psychiatric hospital. How would those two groups change? And the components of the group being composition of the group, selection of the members, functioning, motivation, etc. So by looking, while you're watching the videos of the outpatient group, think about those components of the group, and then when you finish the videos and the work of the composition of the group and the stage of the group and what the leader does and what the individuals within the group do, you can see very easily how an inpatient group differs from the outpatient group. It gets into the responsibility of the leader, being able to communicate, set boundaries, control the flow of the group, what kind of leader they are. Are they democratic, autocratic, or laissez-faire? And I always think laissez-faire, lazy. They're not really doing much of anything except providing cakes and cookies and, the time and making sure the room is comfortable, etc., etc. Democratic, kind of sharing in the leadership styles. Autocratic, really running the meeting. Think of the group and the purpose of the group and the members of the group. And if you have a group of people who can't set their own boundaries or have clear communication, or if you have a short amount of time frame, you might want to be more in charge of the group, moving the group along than you would if you had a group that had an endless amount of time to participate in the group, and you might be able to share some of that leadership with the group. Group dynamics, very important for you guys to understand the different roles of each group member, informal tasks of each group member. While you're watching the videos, you will want to look at each of those members and see if they are displaying any task behaviors, and classify those or role behaviors as task, maintenance, or just the individual roles. I can guarantee you that you can see different characteristics of each of those members and kind of label them with those group member informal roles. Group therapy, again, is very important to have clinical supervision, meaning that you have maybe perhaps another therapist or a couple therapists sit in with the group and observe the group so that they can give the leader feedback regarding how the group is running, what's been done, and what can be done better. What can the basic level registered nurse do? Psychoeducational groups, medication, health education, dual diagnosis, symptom management, stress management, help with running community meetings for groups, as well as self-help or support groups. So really kind of being a leader of those groups, helping the members of the groups interact with each other. Not so much therapy, but more education, health and wellness, health promotion, those kind of groups, either being a leader or a co-leader of the group. That is very clear-cut and simple, I think, for you guys to read through and understand those different sorts of groups. And again, I did ask, you know, with the observing the video, what kind of group was that, and what was the focus of the group. Advanced nurse practitioners, I have a couple videos to highlight the psychodrama groups and the dialectical behavior treatment. The DBT therapy is what the client at OSH was involved in. With you were asking about what group she was in. That is one either individual or group therapy that can be done with people with borderline personality disorder. So I thought you guys would really enjoy that. And you know, there will be other people who use that therapy for that. Goes into dealing with challenging member behaviors. The vignettes in your book is very good about describing those behaviors, what they want you to know, what the test bank wants you to know is how would you deal with that as a nurse, a basic level nurse. How would a nurse deal with those kind of behaviors so that it wouldn't be disruptive to the group, but you also have to pay heed to the need of the individual doing the behavior that is disruptive to the group. So those were monopolizing, the use of silence, complaining, and demoralizing members. Those are those behaviors. Good luck. This is a short video for you. It's just really to get you going into watching the other videos and using the segments in the chapter to identify the makeup of a group, the workings of a group, and learn through applying that knowledge to those scenarios. You have a great day. Thank you.